that's good.
Hey, come in.
Hi, my name is Matthew, nurse today, and I'm going to do a head-to-toe assessment for you. Can you verify your name and date of birth for me?
Reagan Newton, May 15, 2001.
Okay, I'm going to do my hand hygiene. I'm going to close the door for privacy. We'll look at your name check to verify. Okay, look at your, so I'm just going to do a general section right now. Looks like you're appropriately dressed. You look clean. Your skin, let me feel your skin feel warm. I'm gonna check your hair. Alright. I don't see anything abnormal about your hair. Your hair is curly. Is that just normal for you?
Yeah.
Okay. So your skin looks normal for your ethnicity. It feels warm. And then I'm trying to think what else. Can you tell me where you are today?
At the doctor's office.
Okay. Why are you here?
For a routine checkup.
Okay. Tell me what year this is.
2026.
Okay. And then state your birthday and name again.
May 15, 2001. Reagan Newton.
Okay. So patient is LOC is times 4. So she can state the person, place, time, and situation. Did you have any pain today?
No, I don't.
Okay. Now I'm going to just do some assessment. I'm looking at your symmetry of your face. It looks symmetrical. Are you having any head pain or anything recently?
No, I don't.
Okay. I'm going to look at your ears. Alright, your ears look symmetrical. I don't see any lesions on there. Are you having trouble hearing recently?
No.
Okay. I'm going to look at your nose, okay? Your nose looks symmetrical. Any trouble breathing recently?
No.
Okay, can you put one finger on your nose and breathe in? And then put another finger on your nose outside and breathe in. Okay, so patient's nostrils are patent. Just open your mouth and say ah for me. Okay, patient's oral mucosa is moist and pink. Teeth looked intact. And are you having trouble swallowing?
No, I don't.
Alright, patient's throat looks midline. Lean back for me. We'll do a quick check. You look that way for me and then cough. Okay, look the other way and cough. Okay, no JVD present. And are you okay. I think that's it for that. Oh, when you cough these days, is there anything coming up? Is there any sputum?
No.
Okay. Alright. I'm gonna do an eye check here, okay? I'm gonna have you look straight ahead for me, okay? I'm gonna do this side. Okay. And do this side. Okay. Patient's eyes are perla, and also they look like they consent and direct. I don't know if that's the way to say it, but that's how I say it anyways. Okay, and then I'm gonna have you look to the TV over here, and I'm look at this pen, and look at the TV, and look at this pen. Okay, patient's eyes are accommodating, so patient has perla present. Have you ever tried breathing recently?
No.
Okay. Are you having trouble? Have you had any chest pains recently?
No.
Okay, I'm gonna check for your respiratory, and also I'm going to listen to your lungs, and I'm gonna listen to your heart. Okay. Listen to your heart first. I will start in the mid-clavicular line, and go down to the aortic. I'm gonna go right across to the pulmonic, which is the second intercostal space, both of them. And the herbs, which is in the third intercostal space. The tricuspid, and the fourth intercostal space, and then the mitral. If you don't mind sitting up for me, please. The mitral, which is right underneath the breast, and the fifth intercostal space. I would also check for her apical pulse, which I would hear for about a minute, which I would feel for about a minute. We did do your vitals before we came in here, so your BP was normal test was about 124/86. and your heart rate was also normal, which is about not normal, but it was was it eupnea? It's eupnea. Was eupnea and was normal. Sorry, it was normal. About 64 beats per minute. Okay. I'm also going to listen to your lungs. I forgot to do that. Sorry. Have you sit up for me? I'm gonna start up here in the right upper quadrant. Lobe. Take a deep breath. I'm gonna take a deep breath. And one more time. And one more time. It went too low. Okay. And then one more time over here. Okay. One more time. And breathe one more time. Okay. Listen to the back. And take a deep breath. Again. 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 And again. Alright. Your breath sounds normal. It looks sounds normal. I didn't hear any abnormal sounds. What's wrong?
It's not picking you up in the video.
What?
You're not in the video.
Oh, sorry.
I didn't know if it mattered or not.
No.
Just wanna let you know.
Your breath sounds normal. You didn't look like you have normal unlabored breathing. So I don't see you using any of your accessory muscles to breathe. I'm also going to say that I didn't use a bell on you since you said that you did not have any chest pains recently. So I didn't need to listen for anything, any murmurs or anything with the bell side of my stethoscope. Do your respiratory. I'm just gonna have you just relax for a second, okay? Okay, I got about 12 breaths per minute. I did for their second, but it's about 12 breaths per minute. And again, after that. Okay, I'm going to check for your capillary refill. Yes, less than 30 seconds. I'm going to check for any edema. Okay, your skin is also feels warm too, so you're good on that. I'm going to just point out some pulses. Your carotid is right here, your axillary is right here, and then your armpit. Brachial is right here in the crease of your elbow. Your radial pulse is right here on the side of your thumb. It's about +2 bilateral strength on both sides. And then your femoral is right. It will be right here and in your thighs. Then your popliteal is behind your knee. And then your posterior tibial will be right here inside. Angle. Okay, and then posterior tibial will be on top. Now you have your shoes on, but technically I would check without the shoes, but it would be about +1. And then posterior tibial was bilateral, and then posterior tibial was about +1 bilateral. Okay. I'm gonna check also edema. I don't feel any. Okay. I think we're done. Before I forget, I'm going to pause it real quick in here too. Oh, no, it's okay. Hello.
Hey, y'all turn the lights on, we can see.
I'm going to check for your glaucoma scale.
Okay.
I'm going to have you, can you look over there for me? Okay, so patient's glaucoma scale is about 15, so she can respond. She can respond to my command, and her motor looks intact, and so is her eyesight. And her upper motor. Hi, James. Trying to think what else.
Hey.
Hey.
I think we're not going to miss anything. I think that's it. Okay. I know you don't want me to check temperature and stuff, but I'm just gonna check out that you listen to your
Sorry for the audience.
Uh-oh.
Okay?
Okay.
So I would start down here in the lower, so the right lower quadrant, because that's where your bowel starts.
Well, they're trying to do something.
And if you listen to like about 30 seconds a minute. Okay, and I'm going to listen to your cycle buzzing with my bell. And any essential sounds. Are you okay if I put your stomach just listen to? Okay, I don't hear any, I didn't hear any abnormal, your breath, your bowel sounds normal, normal active, and I didn't hear any abnormalities in your medical process. I know you don't want to live in trouble, but it's okay. If you do, I would technically be looking for the shape, the contour, and probably if I could, I would try to feel for your skin if you're cold or warm, any abnormalities, basically anything. And then I'll also look at your umbilicus, if it was midline, if it's inverted or everted. Okay? When was your last, have you been having trouble going to the bathroom?
No.
Okay, and have you had any abnormal urine production?
No.
Okay. I think that's it for that. Let's get hair and nails. We did check for that. I was just asking a good question. Okay. Yeah. True. Just making sure before I go on. Okay. Oh, let's do. I'm gonna do your range of motion. Okay, if you don't mind standing up for me, and just walk across that way. On the way back, can you do a heel toe for me? Okay. Patient's gait looks smooth. Doesn't seem wobbly, and her balance seems intact. Balance seems intact. I'm gonna check your range of motion. I'm gonna check your upper extremities first. I'm gonna do your elbow joint first. If you don't mind, flex for me like this, and then extend. Okay, I didn't feel any crepitus on that side. Same thing over here, flex for me, and then extend. Okay, I didn't feel any there, and I'm gonna do your same thing with your wrist. Can you flex for me, and then extend. Okay, I didn't feel any crepitus there. And then for I'm gonna do your knee joint. Can you flex, and then extend? Okay, and then same thing here. If you don't mind, dorsiflex for me. Yeah, flex. There you go. And then plantar. Good. All right. And then if you have any crepitus on that one, can you do it again on this side? Okay. And I did put a little bit of pressure on you, so I did not. Looks like your range of motion is about a +5, since you could push against my resistance. Oh,
Safety.
Oh, safety. Okay, and then I see that I see there's some stuff on the floor. I would suggest make sure to push it away so you don't trip on it. You have good lighting, so you have a good pathway. I understand you have a kid, so just to make sure that you be careful when walking around. And then I see you're wearing non-slip shoes, which is good. Also, you have wood floor on here too. And did you have any other questions or concerns today?
No.
Okay. Oh, and then before I forget, the doctor did prescribe you a spirometer. Do you have you used that before?
No.
Okay, so a spirometer is just basically testing. It's just basically helping you with your with expanding your lungs. And then so what you're gonna do is you're gonna breathe in for as long as you can, and then exhale. And you're gonna do that about 10 times, or like 10 times every 30 minutes, or every commercial break.
Okay.
Not 30 minutes. Every hour, and about every commercial break if you can. Okay. I don't think I am, but I just want to make sure. I think that's it. Okay. All right, and then I'm gonna do my hand hygiene again, and I'm gonna go get the doctor for you. Okay.
Okay.